we have a question from RT Dhawan.
Yes.
My husband and son both are asymptomatic patients with a count of 30. They are in quarantine since 4 days. They need to get a negative RT-PCR before being allowed to enter the building premises.
Right.
Will show up in the tests. This could be never ending.
Yeah. This is a big issue, actually. And I know Aarti, and I can understand the stress that she's undergoing because of this. And RT-PCR is not meant to monitor COVID. I think there's one more message that needs to go out. The RT-PCR swab is to diagnose COVID, not to monitor it. You can have an RT-PCR positive for up to 2 to 3 months. So it makes no sense to do repeated RT-PCRs, Pradyuman. And as long as people understand this, no society will ask for it to re-enter the building. Apollo Chennai, and one of my close friends who's the head of ID there, has put in this rule that regardless of your swab, on day 11, you are shifted to the non-COVID area of the hospital. Unless you've had severe COVID, which needs more than 6 liters oxygen per minute. And that means that, and in those patients, Pradyuman, you're shifted on day 21, regardless of the swab. So there's no importance of the swab after. The only time you need a second swab is sometimes in patients who are very immune compromised, HIV positive patients, patients on multiple immunosuppressants, cancer patients on chemotherapy. Those are the patients whose immunity is so low that they may harbor replicating virus for a little longer. So there, the ID specialist or someone senior needs to take a call. Can the patient, or maybe you need a negative swab. I still don't know how the negative swab tells you replication has ended, but those are the only, and of course, before you board a flight. Okay, and that's a mandatory rule in India right now. Though I see, again, no reason to prevent a person with mild COVID who's had COVID tested positive on April 1st to prevent him from boarding a flight on 15th April if his swab is positive. Not at all, no reason at all, but you need a negative swab to board a flight. So if you get what I mean, so there are these mandatory rules, and I think those we have to follow. And I guess besides that, there is no need to repeat a swab at all. And a society, and I see this happening with a few societies, and I would encourage your society managers to look at science and evidence before making such rules.
What's happened, doctor, is that the society managing committee and the society secretaries and presidents are now being held responsible by the corporation, and at least in Mumbai.
Yes.
So they're all very worried about what they should do. But you know, to ask you this question now, if I have a domestic help who is not staying at home,
right?
You know, earlier the thing was to do an RT-PCR test, but obviously, even if she or he is positive, the RT-PCR test, if it's not done at the right time, will not show it.
Correct.
So what is the best thing to do apart from not getting the help over home?
Just isolate them. Just isolate them well. Tell them to isolate as best as they can. Sometimes they live in places where it's impossible to isolate. And so therefore, I think that's where the BMC responsibly, we hope, takes them to a quarantine center. But if they have symptoms suggestive of COVID, they should not be encouraged to mingle with others. They should not be coming home to work. Isolate them in the best way you can. And we have seen, of course, wealthy families putting them up in hotels, but not everyone can afford that. So I think the best way they can isolate is what we need to tell them. And of course, watch out for the symptom. Health literacy, as I've always said, Pradyuman, has jumped like by miles in India. In every household almost has a pulse oximeter. Every household is aware of oxygen saturation. Internet knowledge has increased a lot. So I think all these advantages have happened in a span of time which is unbelievable.